Hi everyone. All right, so we're going to talk about sorry, chapter 9, which is education and informatics. Um and this is just going to be a quick chapter. A lot of it is, has to do with our ability to understand where we are with informatics. Those who were raised in the tech age or are really good with computers might think I'm awesome at informatics, but informatics is the exchange of information. So, now most of that is done with technology. So, where does that land on what we do as nurses? Obviously, with the birth of EMR and the high tech, we store and organize information a lot that way. So naturally, when we think informatics, we think along the lines of our EMR and how to use it properly. And you're not wrong. That is a huge gaze into it. And now with all what's going on with high tech and HIPAA and how we're trying to protect our patients' privacy, but also use the data we have meaningfully to improve outcomes, nurses are the natural selection in guiding our informatics. So there's a lot of competencies that you can take to see where you are. If you understand the term SQL language, you understand a lot about informatics. And when I first started, I didn't understand that. So when we're talking about the different ideas in informatics, you have to understand where you are. So there's something called the Tiger initiative, and I put that on the wall, and you guys can kind of guesstimate where you land on what you need. There's so many terms in informatics. If I went through everyone, we'd be here forever. So I encourage you to take the competency to see what you need. And then obviously your part in getting your education here. So one thing that's really important is engaging those that you work with and understanding what informatics is commonly applied. And for many people, they don't understand that there's actually an informatics team, but most places have one. I will say most places that are worth any salt will have some sort of informatics team. Now, they might not be awesome, they're still figuring it out, but you have an informatics team. And so our role as nurses is to use leadership functionality and technology to be change makers when it comes to improving clinical practice and education for nurses and in healthcare as well with our informatics tools that we have. So obviously the EMR is a huge place, but finding out the data that we need. So understanding how to query data and use words and key terms so that you can pull specific phrases is part of informatics skill. So that's also an aspect that, you will get into if you choose to move on in a deeper area of informatics.